Now, the prevalence of dementia is projected to double in the next 30 years without significant intervention. Now, that is the warning from a report by Dementia Australia this week. More than 430,000 Australians live with the condition, which the organisation describes as the #1 public health, disability and aged care challenge facing the country.
There's also a common misconception, right, that dementia is just a normal part of ageing. It's not. And Dementia Australia is calling for federal government help to support a national conversation about brain health. Cale Stokes is the Executive Director of Services, Advocacy and Research with Dementia Australia and joins us now from Melbourne. Good morning. Thank you for your time.
Good morning to you. Thank you for having me on.
What's going on here? Why are we expecting those rates of dementia to climb to that extent in the coming decades?
So the rates of dementia are going to continue to grow if we don't see any significant changes from either a disease-modifying treatment point of view or from changes that we make in our lives to ensure that we retain good brain health throughout our lives. So it is really important that we have a national conversation because, as you point out, Australians generally still have the mistaken belief that dementia is a natural part of ageing and that there's nothing that you can do about it, whereas we know that with a focus on modifiable risk factors, we could actually reduce the incidence by up to 45%.
I wanted to ask you about this misconception, right? The idea that dementia is just a normal part of ageing. Why is that a misconception? Can it be prevented?
Dementia does impact older people more often than younger people, and certainly the risk of developing dementia does increase as we age, particularly after the age of 65 and again after the age of 85. But it's not a natural part of ageing. There's actually more than 100 different diseases that cause the disease process that we term dementia, which is effectively parts of the brain not working and the brain cells dying off. So it is really important that people understand that it can impact people in their 40s, 50s, and some very rare diseases also can impact children. But it's something that, despite the fact that so many of us are touched by dementia in the community, we often don't talk about or hear about.
I keep hearing this term brain health when you talk about the need for a national conversation on dementia. What's brain health? What should we be keeping in mind when we think about brain health?
Well, for brain health, it's often some of the same things that we think about when we think about heart health or reducing our risk of diabetes. So there's really solid evidence to show that there's up to 14 modifiable risk factors for dementia. So we know that if we focus on particularly in our midlife, if we focus on a balanced diet, not drinking too much alcohol, getting plenty of cardiovascular exercise, the sorts of things that keep our bodies healthy and reduce our risk of developing diabetes, maintaining good blood pressure, cholesterol. These things can really make a difference to our brain as well. But often people don't think about, they're very across heart health, but don't necessarily think about how they can keep their brain healthy.
When we talk, Cale, about the need to have a national conversation around this, as you've said, just as part of that, do you feel as though there's still a stigma in the community when it comes to dementia?
Yeah, people living with dementia and families and carers often talk about the social isolation that they experience and some of the stigma and discrimination that occurs after a diagnosis of dementia. There's assumptions that somebody, as soon as they have a diagnosis of dementia, is not able to make any informed decisions or have capacity, that they're not able to make a contribution to their communities. And these things are really impactful for a person that's living with dementia and also for families and carers who often talk about the social isolation and loneliness that they experience after a diagnosis. So talking more openly about dementia and how it can impact us, but also thinking about how we can take steps to improve our brain health is really important.